Something pretty unexpected. This comes directly from an ER nurse in Los Angeles, a major hospital there.
Right, LA.
She just finished a 12-hour shift, and she says, and this is a quote, "Just got off my 12-hour shift, and you guys, our waiting room is just empty, like 4 patients max, like every hour."
Wow. I mean, in Los Angeles.
Yeah.
An empty ER waiting room.
Yeah.
That's really something. Almost unheard of.
Exactly. So you immediately think, okay, what is going on here?
Well, the nurse herself, in the report, she connected directly to the ICE raids happening. Yeah, the Immigration and Customs Enforcement actions. And the immediate takeaway she noted was, patients are just scared to seek medical care right now.
So that fear is actually keeping people away from the emergency room.
It seems like it. A profound impact, changing who shows up, or rather who doesn't show up.
And the public reaction captured in the report, it jumped straight to one conclusion. Pretty understandable, really.
Which was?
The real number of illegals in LA must be astronomical.
That makes sense. If the fear of enforcement is enough to stop people from seeking emergency care.
Right. It suggests a huge number of people were maybe using those services regularly, people who are now, well, afraid to.
It puts the scale of the situation in a totally different light for a lot of folks, doesn't it?
It really does. And some of the comments, they really hit home on the financial side, the burden people feel.
Oh, yeah. Like what?
Well, one person described taking their daughter to the ER, breathing problems.
Okay, serious stuff.
Yeah. And while they were there, they saw 3 other patients. The commenter described 2 as clearly Mexican aliens and 1 with overdose symptoms.
And the point was?
The point was those 3 apparently got their costs covered, no insurance mentioned. But this person, paying over $1,600 a month for family insurance,
gets hit with a huge bill.
Gets hit with an almost $8,000 bill.
Right.
And paid $1,700 out of pocket.
Wow. Okay, you can absolutely see why that would frustrate people. That feels incredibly unfair.
Exactly. That feeling, that unfairness, it's all over the comments in this report. People are asking blunt questions. Like, how much are we saving the taxpayer? It points to this feeling that the system's being, well, taken advantage of.
And there's that specific claim, too, right, about ERs being used improperly.
Yes. A lot of people asserting that illegals, knowing they cannot be turned away, have been using our emergency rooms as a non-emergency primary care plan.
Instead of, say, urgent care where they might have to pay.
Precisely. The comment was, there are plenty of urgent care facilities they can go to. They just don't want to have to pay and plan to walk away from any bills.
So it paints this picture of a system under real strain where costs get shifted onto people with insurance and ultimately the taxpayer.
Yeah.
So if you look at the bigger picture here, it's kind of a paradox, isn't it? Empty waiting rooms sounds like less strain, maybe.
You'd think so initially.
But it actually highlights this deeper issue, the perception, anyway, that loopholes are being used, leading to this unsustainable model where ERs become the default for non-paying individuals.
Right. It doesn't fix the underlying cost shifting.
Not at all. And it raises that big question. What's the real impact, economically, social, when emergency care is seen and used like this? It creates, or seems to create, this 2-tier system.
Yeah, those who pay versus those who allegedly don't. Even fewer visible patients doesn't mean the systemic problem or the cost goes away.
Exactly. A really complex situation there.